Have of doctors as they work to remove tumors from the body. But as Rod Starns explains in today's cover story, medical professionals are taking a page from science fiction as they take aim at tumors.
Robots are being used in many walks of life. Computer programs direct giant mechanical arms as they weld car bodies moving down the assembly line. Now the same technology is being used to help doctors remove cancerous and non-cancerous tumors from patients. Called the cyberknife, it reduces the amount of radiation that goes through healthy tissue, and that's something that conventional radiation cannot do.
Conventional radiation is really limited by the fact of what the normal tissue can tolerate rather than what the tumor actually needs to get treated.
Neurosurgeon Dr. Jason Weaver of the Sims Murphy Clinic specializes in surgery on the brain and spine. He recently completed training on the latest version of the cyberknife at Baptist Hospital in controlled radiation on tumors, but not on the healthy tissue the radiation will pass through.
And this robotic arm basically rotates around the patient to deliver a beam of radiation at various points around the patient's body, so that in theory all these beams converge on the tumor itself, effectively giving a very high dose to the tumor. But because the beams are coming in at various angles through the patient's body, those beams don't give a very high dose of radiation to the tissues that they pass through.
A particle accelerator at the end of the robotic arm generates and fires the radiation. Collimators, metal tubes with different sized openings, are used to control the size of the radiation beam.
The robotic arm will actually pick up a collimator that is specific to the planning that we've done. So for example, if we need a 5mm beam or a 1cm beam, that collimator will be selected.
The basic cyberknife technology was developed in the early 1990s, but new refinements are making it more effective, including an attachment to the particle accelerator that will allow an even tighter beam.
Also housed inside this unit is what's called the iris collimator, and that's a new technology, new to even cyberknife, and we're fortunate enough to have that here in Memphis. And that iris collimator gives us to widen.
The process of aiming the beam includes getting an MRI scan of the tumor, which will show the tumor and the soft tissue around it, and a CAT scan, which shows the bones of the skull or spine. The images are combined in the computer, and doctors determine how much radiation is needed and where it will go. Move when it another moves the patient during treatment.
This robo-couch allows us to move the patient in 6 different degrees. So not only does it move up and down, back and forth, side to side, but allows us to roll the patient, pitch the patient, or even yaw the patient back and forth. And so this has really allowed us to cut down on treatment times and allowed us to even gain an inherently more degree of accuracy.
To make sure the beams are going straight to the targeted tumor, a pair of X-ray machines mounted in the ceiling take real-time images that are constantly compared with the MRI and CAT scans. While the cyberknife gives doctors another alternative to more aggressive surgery, it's not an option for every patient with a tumor.
When it comes to treating various cancers or tumors in the brain and spinal column, there are some cases where this is not applicable. The patient may need surgery, the patient may need chemotherapy only, the patient may need conventional radiation.
While Dr. Weaver will use the cyberknife to treat the brain and spine, the device can also be used for tumors in any part of the body. For Smart Medicine, I'm Rod Starns.
If you want more information on the cyberknife procedure, call this number, 901-226-0340.